This is Boomer Life on CL 650.
Good song.
And there we were just talking about Vertigo moments ago, and our producer, boy, is he fast.
He's
Dwayne
good.
Bishop
He's good.
found U2's Vertigo to throw into the mix
All
today.
right.
As we carry on here on Boomer Life on CIL 650 with our friends from Neurokinetics Clinic in Vancouver. Its founder and president is Philippe Souvestre. Sonia Dale is the clinic manager. J.C. Gordon is director of liaison and logistics. All three in studio today. And the conversation today is largely about balance dizziness issues, which, as we've already found out from Dr. Philippe, it's all brain related. All of these, the balance and the dizziness, Philippe, are essentially symptoms of something far more serious, correct?
Yes, totally correct.
Okay.
Yeah.
So if one, now Sonia, you've already told us that when people call Neurokinetics, it is for many a discovery at precisely the right time, because they've been around the block more times than they'd care to count in many cases, just getting prescriptions and sort of cursory attention and not really addressing the problem. So they finally get to you, and there's an opportunity to talk to someone who is willing to listen and believe whatever. And Philippe, you were talking about your ability over the years. You've taken your traditional European Western medical background and integrated it with a lot of the better parts of the Eastern medical regime to create a new school of thought in which people from all over the world clearly have seen works for them, and they come to Vancouver to your clinic. So talk to us about some of the people and some of the trips that they've been on. In other words, just following up on what Sonia says, the lack of attention, proper attention from maybe more orthodox medical types have created a situation where a person who was experiencing some brain trauma manifesting itself as dizziness is just literally getting worse by the week. So talk to us about what they haven't received versus what you offer.
Okay. Before, thank you for this question. It is a complicated question in a sense. There's lots to say about that.
Yeah.
First of all, I would say that most of the balance disorders and dizziness conditions dealt with mainstream medicine are properly resolved.
Okay.
We only face those who are not resolved. So it doesn't mean all the balance controls disorders and dizziness issues on a chronic fashion are not dealt with Western medicine. They are in a majority. Now, there is a number of types of conditions which are off the scope of this Western mainstream medicine.
Okay.
This is important to say.
Mm-hmm.
So
while Western medicine is capable of addressing some of these issues,
it works very well.
It lacks for others.
Exactly.
Okay.
Yeah. So it is only about a minority of balance disorders conditions which are not well handled in Western medicine.
Okay.
I have become able to understand that and learn about this particular paradigm, which is a paradigm shift as far as brain physiology is concerned, that can explain why the current medical mainstream approach in Western medicine cannot help.
Okay.
What I know, I didn't learn what I know in medical school. It came after I left medical school through a particular combination of Eastern medical training, Western medical training, and also the work, my studies towards a PhD in cognitive and behavioral neuroscience.
All right.
So it is a mix of all of these three disciplines which have allowed me to come to understand what wouldn't be understandable when I was just a Western medical doctor.
Okay, all right. And so those patients who are capable of being well served by typical or traditional Western medicine usually are. Yeah. But then there are those whose case, whose condition, whose circumstances simply are not accommodated by traditional Western medicine. And this JC is the typical patient at Neurokinetics, the one who's a little outside the traditional remedy route.
Absolutely, Sterling. If I could sum it up, I would say it this way: the easier cases or the simpler cases are able to be handled through the traditional Western medical model that we're aware of.
Right, right.
But what we see on a daily basis, Sterling, is that's not everybody. There are still people that are out there that are having the problems, that are having the balance disorders. We just had recently we just had an 89-year-old lady come to see us who in the past 3 years had started falling, was starting to have dizziness problems. She encountered in the existing Western medical model that there was no help for her simply because of in her case, that she was going to have to live with it. She was going to have to live with the falls because of her age.
I was just going to say, you're old, and old people fall down, so
right.
deal with it. Next.
Deal with it. And she's come to see us. We went through the initial evaluations. We're now into the therapy component of it. And after the first session, she is feeling improvements. Why, Sterling? Because at Neurokinetics, what we're doing is we're finding out that the root causes for a lot of these symptoms, certainly dizziness and falling, lies in the dysfunction of the brain, which is the specialty of Dr. Philippe.
Right. Philippe, how do people find Neurokinetics? Obviously, we're doing our best to spread the word today. People come from all over the world to seek your assistance. How do they know about you?
Well, this is a question I don't have the answer. I don't know, quite frankly. When I was in France, when I began my career, I was in the military, and just results caused calls for more results.
Right.
That was in the military, you don't advertise what you do in
True.
medicine.
Yeah.
You just belong to a hierarchy, you're a part of a system, you're a part of a corps, and you are sent patients. You don't have any, who even don't have much choice. They are just sent to you because you're the unit doc.
Sure.
In a particular things. I was dealing with combat pilot units, and when things happen in flight in difficult conditions, one of the most common symptoms is disorientation in space, or spatial disorientation, balance disorders, dizziness, disconnect with environment or disconnect with internal things, and whether physical or mental. And that is also emphasized and magnified by fatigue. So fatigue.
And all of this, of course, for your pilot patients would be happening at 1,000 miles an hour.
Yes, some sort.
Yes, exactly.
Yes, yes.
So, which makes it even more serious.
And those patients, because of the nature of their work, are extremely sensitive to drugs. If you give a drug to a pilot, you will ground that gentleman or that lady for 2 or 3 weeks.
Yes, yes.
Considering the nature of their work. So it is, I made the decision rather to look for drug-less, non-invasive ways to understand and assess and treat this type of disorder.
So there was an interesting challenge that you as a medical, and a flight surgeon with the French Air Force were faced, because you had people suffering from dizziness and other brain-related issues, but you couldn't prescribe for them because they needed to fly. And if you prescribed them, they would be grounded. So how did you, what a challenge, what a great position to be in to innovate.
Yeah, it was a place of creativity for sure. It was difficult because you are also restricted by the model you work with.
Sure.
You're a part of a system and a core. You don't do what you want. But because of my particular trainings in Eastern medicine combined with Western medicine, I was allowed to use techniques as long as they would be shown working, and they did. So I had many times, the satisfaction to see that my pilots were back in the cockpit 2 or 3 weeks before the others, and that was a profound gratification.
But a therapy and recovery program that had very little to do with drugs at all.
There were nothing to do with drugs.
Wow. Okay, we're going to find out how that works. Sonia, let me ask you the same question. How do people find Neurokinetics? You talk to a lot of people who call the clinic for the first time. Do you ever ask them, so how did you hear about us?
I do.
Okay, well, what do they tell you?
A lot of it's, honestly, it's word of mouth. former patients, they know they're a friend of a friend who, has come to hear from us. A lot of them just look up, simple way of internet.
Just do a Google search.
Just do a Google search.
Sure.
They put in a certain word, whether it's concussion, whether it's pain, whether
Dizziness,
it's anything, dizziness,
right,
balance.
Right.
Put in anything, and then up comes certain clinics. There we are, Neurokinetics clinic. But mainly it is through word of mouth currently right now. They know a friend of a friend, or they have a family member that has formerly come and seen us before. They know that, yes, this person was seen here for this condition. They were helped in this amount of time. I should go in and see them now.
Right.
Yes.
Okay. And JC?
I'll tell you, I have never been involved in an organization, Sterling, that receives referrals from NASA and the U.S. Navy like I have been since I've been at Neurokinetics.
Oh, okay.
The referrals come from everywhere.
Okay.
From doctors, from former patients,
Law
from
firms.
from law firms as
Yeah.
well, and from high military organizations as well.
Well, this allows me to stroke Philippe just one more time with this, with this new honor. It's an honor. I mean, really, Philippe, you must feel terrific about it. An induction into the International Academy of Aviation and Space Medicine, and working as JC does with patients referred to you by NASA and other aerospace connections. So, what a tremendous honor for you this fall in September.
It is a great privilege and honor.
Indeed.
Yeah.
So talk to us a little bit, if you would, about the process. Now we've hopefully encouraged someone listening to us who maybe either is dealing with one of these brain or dizziness or disorientation spells or in their life, or is related to someone, or is a good friend of someone. And Sonia, as they tell you on the phone, I've been to Dr. A, B, C, and they go halfway through the alphabet sometimes and go, and I still don't feel any better. So you bring them in, you encourage them to come in and go through the process. So what is the Neurokinetics Clinic process?
It starts off with a simple phone call or an email. Some cases, I know someone doesn't like to call in. The comfort level of calling in and speaking to someone, so they're most welcome to even send us an email inquiry.
Sure.
So we respond back to either or format, whatever they do send us in. From there, we go ahead and start weeding out or listing out the conditions or the symptoms that they're feeling. For how long, what are the symptoms, who have they previously seen before,
Right.
Currently medications they are taking. So we go through a lot of several steps over the phone or through email.
So you work up a bit of a sort of a beginner personal profile.
Yes.
Okay.
So kind of to start off and say, okay, this is what we're dealing with, and then we lead on to what's the consultation process, where we actually invite them to our clinic so they can meet the rest of our staff. They can meet Dr. Philippe and see what I say is the comfort level, if it's there for them. I mean, they're going to be spending a lot of their time with Dr. Philippe, so we want to make sure they're comfortable.
Sure.
Go ahead to move on to the treatment process. So they come in and they sit and dedicate about 30 minutes to 45 minutes of their time, and we go ahead and explain what we can do for them based on the symptoms or information that they provide us
In that email or phone
or
icebreaker.
or the one-on-one consultation time period.
Okay.
And then from there we go ahead after that session, once they want to move on, which goes on to the assessment process.
Okay.
There's 3 of them. So we start with the level 1, which would start on a certain day, so of the week, and then we would go on to a level 2, and then to a level 3. After the level 3 is when the customized treatment program is then made for the patient, which then starts their treatment program from there on forth.
So the 3 assessment sessions, Philippe, are they typically the same for all patients who go through the same series of steps, or do you alter the assessment to suit the individual in your office at the moment?
This is a good question, and that would be the second option. It
Okay.
is we call that as far as the assessment is concerned, and the treatment as well is follow that line. It is a semi-customized pattern.
Okay.
We have a fixed pattern. We cannot go away from, as we would miss a lot of things. But on the top of that, we have also some flexibility that will, and that's where in that I call it semi-customized, will be fitting the exact adequation between the assessment needs and the patient's condition.
And in that first of the 3 assessment periods, and I know from previous conversations with you, one of the tests that you conduct is a balance test, isn't it?
It is. It is definitely part of the investigation.
So does everyone who has some kind of brain issue, and we're specifically focusing on balance and dizziness here, but Dr. Philippe, does everyone who has some kind of brain issue have, therefore, corresponding balance issues?
Yes, to some extent, balance disorders are extremely frequent. They may not be strong, but in some cases, which is a good thing. But when we screen out and we look for them, if there is a connection with a chronic condition, we'll find out always some sort of balance disorders and dizziness related symptoms
in the evaluation
during the evaluation.
Okay, we'll talk more about this. It's quite a process, and it's as Dr. Philippe has just said, it's semi-customized. There are a required series of tests in order for a certain knowledge base to be achieved, but of course in the process that the testing will be customized to the individual in the room at the time. Our guest from Neurokinetics, it's quite the delegation we have in the studio here on Boomer Life. It's quite a busy spot, you know. The coffee people are going crazy around here. Dr. Philippe Souvestre, Sonia Dale, and J.C. Gordon, all from Neurokinetics Clinic in Vancouver at 3195 Granville Street, right there in the Highcroft building at Granville and 16th, and online at neurokinetics.com. We'll take a quick break and come right back at you here on Boomer Life.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.